You know, you can make the argument the most important organ that we have in our bodies is the heart, and February is Heart Awareness Month. I'm Tyler Ryan. So this month on Midlands Cares, we find ourselves at MUSC Heart and Vascular to talk about the ticker.
Well, the heart, I'm a little bit biased, is one of the most important organs because it works for you 24 hours a day. You only rest in between beats, and it pumps blood and oxygen to the rest of your body, to all of your organs.
MUSC Heart and Vascular Cardiologist Dr. Katrina Bidwell making the point that the heart is a pretty important part of hardware, and she says heart health starts with knowing your numbers and your kin.
So things like blood pressure, your cholesterol, your family history.
And of course, there are some non-hereditary behaviors that can truly impact your heart health.
You know, having high blood pressure, having high cholesterol, all of those things are big risk factors for cardiovascular disease, as well as smoking, obesity, having a sedentary lifestyle. There's a reason that that's called the new smoking, being sedentary meaning sitting most of the day. Those are the big things.
According to the CDC, over 30 million Americans have some form of heart disease. But the question is, what exactly is it?
Again, heart failure is, in the simplest of terms, your heart just not meeting the needs of your body.
Putting aside the classic visual of Fred Sanford going to meet his beloved Elizabeth, the doctor says there are specific things that can signal a cardiac event.
For a heart attack, sudden, crushing, severe chest pain that you have never had before, that would be a reason to call 911 and get seen immediately.
She also says for women there may be different signs, including fatigue, loss of strength, and shortness of breath. And although 44% of women over 20 years old have some form of heart disease, the disease itself may not care about gender.
But overall, heart disease is the #1 killer of both men and women, period, both in the United States and worldwide.
Despite the ever-growing number of people who suffer from heart disease, Dr. Bidwell has some encouraging words.
I tell my patients all the time, there has never been a better period in time than 2023 to have any of these diseases because we have so many options available. That's why I love this field so much, because we are able to partner with our patients to help improve both the quality and quantity of their lives. But you gotta come see us.
So I think the message is pretty clear. Whether it's something hereditary or maybe choices you make, it's never too late to start taking care of the heart. For more information on all things heart related, you can check out the Midlands Cares tab at abccolumbia.com. In the meantime, here at MUSC Heart and Vascular, I'm Tyler Ryan. If you excuse me, I've got to go see, a patient.